Welcome to The Authority File, the podcast where you'll hear conversations with academic librarians, technologists, researchers, and authors whose work is laying the foundation for higher education's future. I'm Bill Mickey, your host and the editorial director at Choice. If you're new to The Authority File, you can listen to and find previous episodes on most of the major podcast platforms, and we encourage you to sign up for our monthly newsletter, The Authority File Roundup, which keeps you updated on previous, current, and upcoming Authority File episodes. You can subscribe at choice360.org by clicking on the newsletter banner at the top of the homepage. My guest for this four-part series is Dr. Rebecca Cooney, chief editor of a new Nature journal, Nature Mental Health, set to debut in January 2023. Dr. Cooney and I discuss health equity in mental health, what that looks like from a clinical perspective as well as an academic one, and how the new journal will be addressing that across its entire editorial production process. This series is brought to you with support from Springer Nature. In this second episode, we explore what it means to achieve equity in mental health. So the description of the new journal's scope notes that mental health is a human right. Can you talk about why it's necessary to make that statement? What does that infer about general attitudes toward mental health?
Yes, I think that there's still a very widespread lack of buy-in on the concept that mental health is a universal right. I think, and that's very much related to that is not always buy-in on health being a universal right, and so I think what we have to do here as a journal is to be really explicit that that's the framework that we are working from. And
Yeah.
it does have a lot of sort of consequences to that. I mean, in positive consequences, we're able to incorporate things that like the UN's Sustainable Development Goals and look at research specifically that might, cluster around those. But it also means that the way that disorders are framed and the language that it's used about those is also from a human rights positive perspective. So I think it's really it behooves journals to be specific about kind of what the stance is on that, because I think it helps encourage dialogue around that and to promote more of a general acceptance of that.
Mm-hmm. Excellent. So let's talk about health equity in mental health. What does that entail, and what does that look like from a clinical perspective?
Yeah, so in the same way, I think that the kind of this idea of health being this massive construct, and then mental health is sort of a massive construct that we all have. I think that when we're talking about health equity and mental health, we have to kind of revert to looking at, well, what's the difference between equity and equality? And
Right.
in the sense that, I would say that we don't have in the US really a functional system for mental health access and delivery of care. And that's really, it's an issue of mental health parity. So even though we have healthcare plans that may have some provisions for mental health, they don't have the same sort of, guidance of this is what constitutes a mental health care plan per
Right.
se. And so the issue is that if we looked at something from an equality lens, we could say, sure, there's inequalities, but also we may be sort of equal in our mental health, and that there is very little provision for care. And in some places where there's simply no provision of care, then they do have, in some sense, mental health equality. So it's not always a useful way of sort of looking at where things stand, but to look at equity is kind of the idea of looking specifically at where people need to be met in order to produce a positive outcome. And I think that is a hugely important aspect, and really also speaks to sort of the public health and sociology aspects that we are interested in. And coming to the sort of buzzword of the day, which is social determinants of health, we have to understand that these are just these major forces that can impede any sort of progress in mental health. So these are hugely important for whether or not an intervention in a certain setting fails or whether there are positive outcomes. There are other stakes in terms of where a person lives and where they've grown up and their access to other opportunities that really are affect all of these. So in terms of mental health equity, it's thinking about what needs to be done differently in order to make mental health interventions successful, or how do we tease apart when something is, specifically due potentially to an intervention or specifically due to just the situation in which the person lives. And there's just some really powerful demonstrations of this, and I think that we need to make sure that we're elevating that construct into kind of across the board of every paper that we publish is,
Mm.
where does this fit into a mental health equity model? So this could, from a really, high end perspective, kind of thinking about when we have things like transcranial stimulation, is that something that will ever be available in certain environments? Not necessarily. Are there certain types of antidepressants or other SSRIs that won't have general uptake because there isn't anyone to administer them or to make sure that people are actually following a regimen? So thinking about sort of the buttress that we need to build to make sure that we can achieve mental health equity.
Hmm. So a follow-up to that would be, as you're thinking about that infrastructure and the potential need for that, how does that show up in sort of your editorial strategy in terms of commissioning articles? That are you asking for that perspective in each of the articles you commission, or case by case, or how do you make sure you're addressing those issues of infrastructure within the research you're commissioning?
So I would say that it's really important for us to consider that there are other stakeholders beyond simply the people who are writing
Mm.
or and conducting the research and versus those who are reading about it.
Mm.
And so much of what is going to be published, I think in the next 5 to 10 years, is going to have really specific implications for policymakers and advocacy groups. And how do we make sure, editorially, that from the outset we're involving them in kind of shaping this journal to include information that's relevant to them? And there are always sort of on the table ideas about doing lay people summaries. That's not something that we're going to start with, but it might be something that we build to, and sort
Mhm.
of in collaboration with other journals and figuring out what is the best way to transfer information in that sense. It means really liaising a lot with science journalists and how we talk about certain conditions, or, does language need to be updated? It's been a really interesting sort of endeavor with respect to some of the perspectives and reviews that we have sort of in the pipeline, and how do we kind of remove ableist language,
Mm.
which can actually, it's really an interesting question. So does a word like burden, does that carry something that is much more loaded than we would think of when we're just sort of calculating the number of people who have a disease and thinking about it from an epidemiological standpoint? Also, I think that one of the really interesting innovations that we will see more and more of is that mental health research funders are also very interested in bringing in the lived experience voice to the process. And that can start very, very early, like during sort of planning the design of a study, to
Mhm.
have people with lived experience to come in on comment on it. I mean, there are just amazing examples too, if you look at even doing work with adolescents and just having young people who are evaluating materials, it improves the quality of the science immeasurably, I think, to have the people whom it affects and it's
Hmm.
about be part of that process. So we're really excited to be partnering with a lot of different groups around what they're working on and how that can be balanced across different types of journals, and because certainly there are mega journals to consider that are publishing lots and lots of papers, but and again, to our sense of being a high touch, we think that we can potentially be a leader in this, and finding ways to do it, and then finding ways that are practical and sustainable so that other journals could adapt to it.
Right. Excellent. Good. So that kind of segues really well into my next question, which is, looking at the role of journals such as Nature Mental Health in using science to influence social change, you know, s- going beyond goodwill gestures, for example. I mean, how do you see that happening?
I think that one of the fundamental truths about science is that it's undertaken for the greater good,
Mm,
and
yeah.
so we often, I think, get away from that idea. But you know, whether we're trying to understand really elementary processes in brain function to what produces an emotional state or a mood state or what actually is a diagnosable disorder, all of these pieces are undertaken with the idea of being able to intervene and to improve something that is a negative state for someone, and that all is part of a greater good type of ideal that we're working toward. And so I think that it marries very well with the idea that journals should be advocates for social change, and trying to align better with things like mental health being a fundamental right.
Hmm.
And we have various editorial mechanisms where we can do that really pointedly, like through writing an editorial, for example, where we want to underscore that. But I think one of the interesting and sort of exciting things about science is sort of this self-correcting construct, and I think in the same way too, how we discuss these issues in terms of what our social responsibility is, it is self-correcting. We're seeing massive self-corrections right now, so I think that we providing a forum for people to discuss these ideas and how to do things better, and to just raise awareness, even if it takes a lot of awareness raising, to get people to understand that it's in the surface of self-correction. It's in the service of the greater good.
Yeah. Yeah. So can you give an example of some of those major self corrections that are happening within science?
Yeah, I think within mental health, a lot of it originated with doing more person-focused
Mm,
language. So instead of saying schizophrenic, it's a person with schizophrenia. But
right.
even that is a really interesting example in that there are people who are living with that and would like to actually be referred in a different way. So it's sort of, bringing about this constant dialogue and balance and acknowledgement that there are going to be some disagreements, but also transparency of when you do make editorial decisions about this. And
Mm,
I think that Nature Human Behavior has done a great job of sort of expressing the current landscape of thinking behind this. Is that we, in the same way that physicians are not supposed to do harm, I think we as editors have sort of the same mandate for ourselves, which is that we can't promote or interpret any science to cause harm. And
mm.
so by putting in some basic checks and balances and reining it in somewhat, I think we're actually providing a more honest and complete and helpful version of the rendering of the science that's been done.
You just heard from Dr. Rebecca Cooney, chief editor of a new nature journal called Nature Mental Health. Join us next week as we look at how scholarly publishers can go beyond pledges and statements to put DEI policies into practice. This series is brought to you with support from Springer Nature.
I think pledges are actually a really useful start, and they're sort of like the New Year's resolution of a journal.
Yeah.
That by communicating that what you're hoping to do, you're formalizing it into an agreement with the audience,
Right.
and audiences will definitely hold you accountable to these ideas. And there have been, especially at the level of a lot of the major medical journals and major society journals, sort of these expressions of various aspects of DEI that they want to espouse in their journals. And a lot of times it comes from having a major sort of dust up that is very public, and that
Right.
then, the mea culpa is to sort of do these things. We've been really lucky in that, being a new journal, we can sort of put those New Year's resolutions to work from the get-go. And then also, in the sense that we will be monitoring how we do, we have, baseline starting from the very beginning.
As always, underwriting opportunities for the Authority File podcast are directed by Choice's advertising manager, Pam Marino, and all of our episodes are produced and edited by Choice's digital media producer, Sabrina Kofer, with support from digital media assistant, Ashley Roy. That's all for this week. Thanks for joining us.